Uh, Hi everyone, Rafael from Living Energy Pilates and Rehabilitation here. I've had a lot of clients come in recently complaining of tennis elbow. That is a pain in the lateral epicondyle of the elbow here. Uh, and I thought I'd just share with you some tips on how to best manage it. Now, you might have also heard it being called lateral elbow tendinopathy or lateral epicondylitis. They are slightly different, but for all intents and purposes, very, very similar, sort of same. We treat them much the same. Okay, now, tennis elbow is, as I said, is felt as a sort of a pain on the lateral epicondyle of the elbow, and particularly along that tendon area. It can be a burning sensation or just a tenderness, or can be quite a strong pain, depending on how acute it is and how aggravated it is. And usually there's not a lot of actual swelling, just aggravation of the tendon. Essentially it's a chronic overuse tendon injury of the common extensor tendon of the forearm. So that common extensor tendon basically does that movement, so extends the wrist, extends the hand, and it attaches right up in here. Okay, now often when it starts, you'll notice a gradual worsening of maybe some low-level symptoms initially, but they get gradually worse. Or the other way that it often starts is, you might have done something really repetitive over the weekend or at work, and it's suddenly very acute or very inflamed. But no doubt you would have had some sort of maybe low-level symptoms in the past or previously, because it's usually there, it's underlying, it's ready to go, and something just really irritates it or aggravates it. Things that aggravate it are basically extension of the wrist, so things like gardening, painting, using hand tools like carpentry and plumbing sort of stuff, racket sports, obviously where it gets its name from tennis, but even things like working on the computer at work and using the mouse, turning your wrist like that, they can all aggravate this tennis elbow. Now, it usually improves with rest, but sometimes it just takes a long time. So you might find that you might also notice your grip strength has decreased, and in more acute cases, or longer term cases I should say, it might even affect up into the shoulder, because you might start to adapt what you do every day, and you might start to use your other arm, your good arm, and so subsequently this hand starts to weaken and that shoulder starts to weaken. So basically, how do we manage this? So firstly, in terms of pain reduction, you want to manage it with ice. So icing over this area, this elbow tendon area, is going to be helpful just to reduce the pain. It has an analgesic effect. Secondly, taking actual pain relievers, so some sort of medication. Obviously speak to your pharmacist to find out what to take, but some sort of pain relief would help too. Other therapies that can be useful, dry needling. Dry needling can be helpful to manage the pain. Again, it usually decreases the pain, helps create some blood flow into that area, so it helps with healing. It just speeds it up a little. But things that you can do other than the ice, you can do a bit of cross-friction massage. So just using, say, 2 fingers, massage over that tender area along the tendon, just up and down a little bit, but up and down like this, so crossways. And you're basically trying to break up the scar tissue and adhesions that are often associated with this type of injury. So that can be useful, and it will be tender at first, but as you do it, it should decrease. The other important things you can do are activity modification. So if there's things that you can change, that repetitive movement that's irritating the tendon, if there's things that you can change, then you really should. Or introduce little rest breaks into your work or routine. You can also buy like a compression bandage, which helps basically reduce the amount of force that you put through the tendon, so that can be helpful. But yeah, we normally say relative rest, so basically reducing the amount that you're using it will certainly help. In the longer term, or even actually in the short term, isometric exercise can be helpful. Now, I'm going to talk to you more about the exercise component in the next video, because ultimately we do want to strengthen the tendon and make it thicker and stronger, and that's your really long-term solution. So I'll talk about that in the next video. But don't forget to subscribe to our YouTube channel, and we'll talk more about exercise and how to overcome tennis elbow in the second episode of this series. Thank you.